Okay. And if a woman has, let's say she has breast implants and she's really unsure, she's experiencing symptoms, she's going to several doctors, perhaps not getting the answers, not getting the guidance, what would you say to her? How does she know that this could be associated with her implants? Are there striking signs, red flags? Let's jump into that.
Yeah, that's the problem, right? So they've went to the rheumatoid doctor and the GI doctor and the maybe the OB-GYN or the endocrinologist for all the different, referrals they've gotten from a GP who said, I don't know what's going on with this. So, now you're kind of getting to the patient I see who's gone through the rung of, Western medicine, and they've typically gone to integrative or functional. They may have seen a nutritionist, a chiropractor, a acupuncturist, all these different providers to help resolve what they're feeling. That may be brain fog or fatigue or anxiety or muscle and joint pain, GI problems, urinary tract problems, skin rashes, like all these things that don't really add up to make a specific diagnosis for them. And talk today, there's not one test that I can do that will help say yes or no, you have this problem. I look at it like this. About 29% I know will have a bacterial contaminant on explant. If you have bacterial contamination, that can definitely stimulate your immune system, and you can have more and more symptoms. This was shown in a paper last year by Mithun Suna, and there's a molecule that I hope will become a molecule we can test for. It's called oxylipin 10-home. So this would be what everybody wants to know. Like, is there a blood test, a biomarker, if you're familiar with that term, that we could look at to better characterize this? So if in fact you had that bacterial contamination with specifically something like Staph epi, this could be an avenue to look at that. That's been done in research models, and we hope to have that commercially available. The other is when people explant, they want to know like how well they're doing. And there's been papers published about fibroblast growth factor 19 as another biomarker. So I feel like the science is moving along. It's not where we want it yet. So